safe for brain cancer, and also we have many ingredients. It's helpful for the itself, and also it's safe and also improve the chemotherapy efficacy, because when we have chemotherapy, that all those drugs is considered as toxic by the cells. Does it say this?
Yeah. Okay. Any more questions, ladies and gentlemen? Yeah.
Yeah.
And any questions? If you, yeah, sorry.
I didn't finish the question first. So, the chemotherapy, those other drugs are considered as toxic for the cells. So the cells will put them out. So then absorption rate of those chemotherapy drugs will go down. To solve that problem, the doctors are using one type of thing called the P protein inhibitor. So with that one, that can increase the absorption rate of many chemotherapy drugs. And the RG3 of our product is considered one of the best P protein inhibitor. So it can improve the chemotherapy efficacy.
Okay, the next question is asked by Joe Tan. He said, hi Jeff, what is the ratio of ginseng to 3 fruits? The 3 other ingredients, what I think what he she
actually
meant. And any fruit?
Yeah, so sorry. Yeah. Any fruit kind of
any fructose or sugar added? Yeah. Yeah.
Extra sugar or fructose are added at all, for sure. And the ratio of ginseng to the 3 fruits, actually the ingredients, I don't remember the exact, but what I can say is that most of the CV8 is the cultured wild ginseng kind of liquid we have right now, and all other kind of fruits, it's mainly for the formulation and also for the flavor adjustment purpose. So
okay,
diabetic. I think you ask this from the diabetic patient point of view. If you have diabetic, it's fine. Diabetic patient doesn't mean that it not consume sugar at all. No, it's not. Just the how to say that the metabolites of the sugar in your blood is kind of really not stable. So all the kind of sugar content inside of CV8 is very safe, and also the more importantly, those things that we put inside of CV8 is helpful for your blood kind of sugar to get adjusted. So I think that I just showed everybody that there's one slide. It's called the blood glucose regulation. So we have lots of kind of papers and also patents to prove that part. So no problem.
Yeah. Okay. The next question is from Ivy. My husband had a cancer. After chemo and radiotherapy, he developed hepatitis. Can he take CVA?
Hepatitis has many different types. So first of all, whether he can take CVA, for sure he can. No problem. It's good for liver protection, including virus kind of caused kind of liver damage. And actually, for if hepatitis A or hepatitis C, or they have many specific treatments. So it's better to follow the protocol of the hospital, the doctors to give you to treat this kind of hepatitis. But everybody knows the hepatitis B, that it's almost impossible to be cured. But actually, we are developing this, not CV8, but another product. Another one actually can help people. There are billions of people in the world have hepatitis B. I think everybody knows that, right? And we can help them to get rid of hepatitis virus completely. And it's in the progress, and the current result is really good, more than 40% already. But we're improving that. But CV8 is not developed specific for that purpose ratio, but it's good for the liver. The proof of that. So it's very important. can he have it? Yes, he can, and it will help his liver and also help the treatment of hepatitis.
Okay, the next question, someone from called Billy Sim would like to ask some questions. Okay, Billy, are you ready?
Yep.
Yeah, go
Hello.
ahead.
Yeah, Mr. Jeff. Yeah, good to
Hello.
listen to your talk. Yeah, I first saw you speaking to us when you were in Korea. I'm very impressed with the process of this extraction of stem cells from the ginseng and the patented process that you're using to multiply these stem cells. As you're mentioning about this diabetic control, how long would you expect this parameter to improve for a diabetic patient who are on the tablet as well as on insulin? What's the duration of time after taking CVA that you can actually see the parameter of normalization of control of glucose in patient? Say, and what is the
So first of all, I want to say another time is that CVA is not a drug.
Yeah.
So please do not expect as a drug type of kind of result here when you consume. But actually, it's better than drug. So for example, I have some friends who got diabetic, and everybody knows that there's many kind of co-symptoms of the diabetic, like their feet got weak, and also many other problems. And one of my friend actually just have it for 2 days, and then those wounds on his foot become to heal. And after 3 days, he can walk. Of course, limping, but still he can walk. Be on a wheelchair. And also, for example, my father, who already had a diabetes for more than 10 years. So he's having the insulin injection every day. Before, he's having about 21 units. But right now, he's having daily, sometimes even it's better than no need for injection at all. So it's different from person to person. And also this CV8, all those kind of, how to say that, pharmacology, from pharmacology kind of point of view, it's help the blood kind of sugar metabolite, but more importantly, that it improves the health of your intestine, and then based on our kind of experience, that it's better because diabetes is not some disease that you just get it diabetes in 1 month. No, it's caused by or even decades of bad living habits or other things. So it's difficult to kind of reverse everything within 1 day or something like that. But usually, based on our experience, as long as you are consuming kind of suitable amount of the ingredients, the dosage is suitable, so basically not too low, as high as possible, and then kind of pattern, and then usually after 1 week you will start to feel the difference, and after 1 month that the high blood pressure, especially blood pressure, the usually normal people should be 6.5, something like that below. After 1 month, if you test that again, it'll be improved, but different from person to person. And if you need, I can share many kind of paper and articles about how these kind of reagent senocytes can help the diabetic people. Yeah.
Thank you.
Okay, Billy. Yeah. Okay, the next person is actually Anthony Ching again. He wants to ask some questions. Anthony,
Yeah,
are you
thanks.
there?
Thanks, Andrew.
Okay, go ahead.
Jeff, I've got a friend who's under dialysis. How can this help with a dialysis patient?
Dialysis, it's a pretty, somebody can help me to translate Chinese. It's really familiar, but
season.
okay, yeah. So sorry about that. It's not that good news, but there are two parts in everybody's body is not fixable. One is the kidney, another is the neural cell or neural system. so it cannot be regenerated. So for that one, it can have overall or general body condition, but it cannot reverse the kidney health. Sorry about that. So it can help that person or your friend. He will feel less fatigue, and also will heal or kind of with better kind of energy, all those things. Yes, but for the kidney-related disease itself, if it's just a stage, then it's some inflammation. It's helpful. Really, into that damage.
Sorry, Jeff, can you hear me? Hello? Hello?
Yes.
Jeff, your line is
Yes, I can
breaking.
hear.
Can you repeat the answer again because your line is breaking just now?
Is it better now?
Yes.
So basically, any kidney-related disease, especially when it already hit that kind of fatal disease status, can help reverse.
Hello?
Hello, can you hear me?
I think your line is not very good. That's why it's the voice is keep breaking halfway through. Okay, but now your line is, I think, is okay already. There's no red signal, so you can. Sorry, you can continue now.
So maybe
Can you hear
I'll
me,
just use
Jeff?
type. I can hear you. I
Yeah.
can hear you.
Yeah. Anthony, because the line is not very good now, Jeff is typing his answer on the chat, so you can take a look at the chat.
Thanks, Andrew. But I basically got what he wanted to pass the message. It's okay.
Yeah.
Thanks.
Yeah. Okay. Okay, there's a lot of questions waiting for Jeff to answer. Let me just go through one by one first. Anthony Ching also asking, the Chinese believe that when a person is weak, wild ginseng is not suitable. What is your opinion on that? Okay, we will. Jeff, you're going to answer all the question on the chat, or you want me to read one by one so that you can at least, if your line is, I think your line is quite okay now. I don't see any red alerts. Yeah. Okay, for the benefits of everyone. Okay. This is a question. Can a CVA help a person who has suffered right brain damage due to accident and he is paralyzed on his body and loss of speech? Kindly advise. This question is asked by Sally.
Answered. For any blood circulation problem is helpful, but because the paralyzed thing is caused by specific structure damage in the brain or in the vessel, so it depends on the patient status. So for many kind of stroke people who also got paralyzed, but some people are really lucky, and after drinking this thing, the CV8 and also their blood kind of the vessel become kind of how to say that, normal again, and then they can move just as normal people. So we have many cases like that. But if it's from a car accident, I don't know that how the structural kind of damage it caused. So it's really cannot be answered through just one line. But it's helpful for the blood circulation for sure.
Yes. Okay. The next question is by Lo. Is the CV8 after expiring date still can be taken, or the longer we keep, the better it is?
Definitely not. The longer, the better. Definitely not. And also because there's no expression that actually should be okay to consume, but when you see it's kind of, how to say that, with some extra gas inside, do not have it at all, even it's within expiration date. But most likely it will not happen, but it's recommended to drink CV8 within the expiration date. As not early the better. You can have it fresh, right? Everybody has the fresh one. It's not like the wine.
Okay. The other question is, just now Ivy was asking about the hepatitis. So she said that the doctor has given him.
Yeah, you can have simultaneously without any problem. No problem at all.
Oh, okay. Okay. So the next question is, can CVA helps on hepatitis C patient? Possible to cure?
Helps, but please do not use CV8 as the cure. For hepatitis C, actually about 2 or 3 years ago, there's one really successful drug launched. So hepatitis C can be cured really easily now. So that C.
Okay.
And that drug may cause some fatigue and other side effects. Of course, that CV8 can be helpful. And actually, CV8 is good for hepatitis C, yes, but if you use that as a cure, it may be not that efficient. That's what I'm saying. So.
Okay. Can CV8 help a lung cancer patient whereby the cancer has spread to the bones?
Helps. But please also follow the hospital protocol. At the same time, use CV8. I mentioned that it's a really kind of last kind of stage, so it helps. But CV8 is not a how to say that, kind of legendary drug, and it's not like that. But it helps. We have many papers on that, but the dosage and also the formulation is not optimized for cancer treatment purpose. It's for immune enhancement. It's good for the blood circulation. It's good for but it's not optimized for cancer treatment.
Okay. This question by Lo. He was asking, and while ginseng, the nutrients need to accumulate over times under natural environment. But how can CVA be getting this material in the lab or factory? Are we really duplicate, or is it an artificial chemicals?
Okay, it's a great question. So actually, for example, those ingredients in the 100-year wild ginseng, it doesn't take 100 years to get produced. It takes us maybe 10 hours, 20 hours. The reason why the content is so small is that within that 100 years, only maybe 2 or 3 days in the morning or in the afternoon, the environment was so harsh. The wild ginseng itself almost died, right? Yeah, and they cannot move. They don't have food. They cannot move. And then they have to utilize maybe certain piece of their genes so that they generate some useful components to protect themselves. So along the whole 100 years, maybe those extreme weather or extreme environments only existed for maybe 10 hours or 20 hours. And that's why its amount is so small. Okay, then in our lab, throughout different kind of culture condition, we discover what kind of culture condition will enable this cell to utilize that specific gene to produce that specific ingredients to protect themselves. And then consider this, 1 century, 10 hours, but every day we have 24 hours, right? And then every week we have 168 hours. 3 weeks we have more than 500 hours. And then in the nature that the environment may do not push too far away from the limit of that stem cell or the ginseng. Maybe only kind of open up maybe 30% of its potential. But in our lab, we have so many cells, so we can test all different kind of extreme conditions to maximize maybe 90% of its capacity. So consider this trillion of its okay? In the wild, it only runs 10 hours for that purpose. But here, we run 24/7, okay? So 3 weeks, then 500 hours already passed. And then we're also using that with the biggest kind of efficiency, right? So amplify all this kind of potential. So that's why we can have lots of kind of useful ingredients. It's not artificial chemicals. It's naturally generated by the cells under specific culture condition.
Okay. Billy was asking, is there supposed to have a residue in CV8?
No. There's none.
None, huh? Okay. And Sally was asking, can CV8 help fourth stage prostate cancer?
It helps. It helps, but you can say cures. Why doctor taking CV cause gastric? You mean some kind of gastric kind of gas, something like that? I really don't understand specifically, but actually among the absorption improvement system, we are using some prebiotics to help the bacteria grow in your kind of digestion system. Residue means 沉淀, right? So something in the bottom. Yeah, of course there is. That thing is the good part. Please do drink that. Because those are the stem cells. Stem cells do not dissolve in the water. And all those virgin cells, most of them are in those residue. It's the best part. Okay, please do take them. That's the most important part. I thought, sorry, I mixed up that with the kind of 防腐剂. Sorry about that.
Okay. James was asking in which way CVA can help on skin allergy, especially itchiness or on recovery.
By orally consume it, actually it helps the immune system. So many allergy problem is actually caused by the immune dysfunction. And actually you can just directly apply CVA on your skin. It's also helps for your skin recovery. That's another way, but it's actually the cosmetic field.
Okay. Any more questions, ladies and gentlemen? If no, then we will finish off the talk here today. And of course, once again, thank you very much to Jeff and also Miss Sun Mi Hong. And before we say goodbye to each other, I'll unmute all of you so that you all can give